a great organization, especially a great manufacturing organization, should have these attributes. So we can actually make the manufacturing game a little bit more interesting and much more competitive when we focus on innovation to create speed, agility, and competition. So this is the actual data of the titer of the Roche genetic product over the last 20 years. So the blue square on the left-hand corner of this chart is 15 milligram per liter. That was TPA. It's a therapeutic protein produced in 1985. In case you couldn't see it. 15 milligrams. And so the titer had been steadily going up. So when I arrived in Genentech, it was 2003. The titer is about 1.2 at the time, and it's growing at a trajectory of about 25% improvement over 4 years. So I got the team together and we said we shouldn't think about percent per year increase, we should think about how many years does it take to double the titer. So we agree on a goal of doubling the titer in 4 years in 2003. So we had far exceeded that expectation. So it was again 1.2 grams per liter on average in 2003, and it was 8 grams per liter 4 years later. So this is a sort of interesting historical data to show that how we can make the game really, very, very different. The way we see the biologic manufacturing, biotech manufacturing, and I really don't have time to go into details, but the simple message is that with the significantly higher titer to manage, obviously the work is going to shift to a downstream innovation, and we believe that is happening, that will happen. And process simplification and the manufacturing industrialization will be the sort of the two key characteristics of a biotech industry, in my view, in our view, from looking from Roche to Genentech. We believe that there will be more and more standardization, and the same type of technology will be used more and more by all of us around the world. So then what does it take to succeed if you think that biotech will be industrialized? When after it's industrialized, obviously you need to succeed, you need great leaders and great team. You still need a very significant amount of capital. Today, to build the current scale, which is typically 12,000 liters of fermenter in the mammalian cell culture manufacturing, you're still talking about $300, $400, $500 million US kind of capital. With the disposable technology and a much higher titer, maybe that number can be reduced because the footprint of the plant will be much smaller, but still your downstream columns will continue to occupy a very significant amount of capital requirements. The know-how obviously is going to be a key, and coming to China, all the biotech colleagues I run into are pretty much graduate from all the US and European companies, so that know-how requirement appear to be much more easily acquired nowadays than in the past. Investment mindset, one of the challenges for some countries is the electronic investment mindset. In the electronic industry, you invest something and you expect to get a return in 2 years. 2 years is quite long, sometimes in 9 months you expect to get some return. In our industry, we're looking at 4 to 5 years minimum, maybe even longer. So that mindset, the investment mindset, is very different in the biotech industry. So for certain countries, when you don't have the patience, this becomes a huge challenge. The ingrained quality mindset and respect for IP is another one that represents a certain level of challenge in certain parts of the world. Ingrained quality simply means that it's ingrained in your culture, in everybody, and over a long period of time. It's not just quality for the month that your customers visit you, it's quality every day, 365 days a year. And you obviously need scientists, good scientists, you also need good engineers, and you have hardworking people and who will dedicate it to your company, so much the better. So I picked one out of these things and I spent a little bit more time because people often ask me, what do you use to, what do you look for when you hire your leaders in manufacturing? And I seem to always come back to these 11 items. I always look for someone who has a passion for operation. People have different passions. It's okay if your passion is in selling and in marketing and doing things like that, but if you want to work in manufacturing, the passion for operations is a must. That's my number one criteria. And I also look for people who are connected with reality, who walk the floor, get the real data from the workplace continuously. And the ability to hire great people is a very important attribute for a great manufacturing leader. The ability to facilitate, to be a great facilitator, a great teacher. Not just they know how to do, they also know how to teach people how to do. A principle center, a predictable person. I'd rather work with someone who's predictable, who is a little tough, maybe a little nasty, but predictable nasty, than someone who's unpredictable and nice. Trustworthy and candid and transparent for me is very important. Follow up for me. Follow up in manufacturing, you've got to take action plans, but keep following up, always meeting commitments, and attention to details in our business. Manufacturing, especially in biotech manufacturing, attention to details is so important. Judgment and decision making, I covered that a little bit, and then the emotional strength to be able to make tough decisions sometimes against the popular opinions. And finally, the EQ, emotional intelligence, not just personal productivity, but interpersonal productivity, the ability to really to get everybody work together as a team. So that's sort of I would expect what you see in a great manufacturing organization. Biosimilars is a very hot topic. You'll probably hear a lot more in this conference. I borrowed this chart from Stephen Kolosky's talk of the FDA, and so the highlight here, the important message here is that when you look at a biotech product, especially monoclonal antibodies, if you look at just the assays, the data, the quality information, preclinical as well as clinical data of the products, then you are only looking at the tip of an iceberg, a huge iceberg. There is a difference between comparability and similarity. You could test a product, say a monoclonal antibody, and determine that the products are highly similar. You really can't not provide comparability until and unless you have the process data that you can compare, the process history of that molecule. Since most of the follow-on biologic producers do not have the innovators process history, it is unlikely that a biosimilar producer can truly produce comparability data. They can produce similarity data, but that's just the tip of the iceberg. And the bottom, the huge chunk of the history of the processes will remain unknown between the two molecules. So here's a chart that I used a few times to sort of symbolically, graphically show the differences in complexity. If you look at the molecular weight, you're beginning with a small molecule, say Lipitor, and compared to a therapeutic protein, for example, interferon, you see an order of magnitude or 18 times as heavy in molecular weight. And then going to monoclonal antibody, you see another 8-9 times of increase. But when you reach that far right-hand side of the screen, the monoclonal antibody, it's no longer just the weight. It's also the glycosylation, the geometry, the shape. There's the complexity that comes with that product that is challenging to all of us. We all know that you can have the same or similar, identical DNA sequences as the innovator. That is possible. That's about the only thing that is possible. The rest of it, how you clone that into the DNA vector, how you wrote it in the media, what media do you use,